Gentlemen, there's something I need to tell you about a secret weapon against prostate cancer. Now, I know this might sound like I'm about to sell you some miracle cure, but bear with me. This isn't about pills or potions. It's about something much more down to earth, and frankly, something we all do. Are you ready? Masturbation. Yep, you heard me right. And before you click away, thinking this is some kind of joke, or get all red-faced and embarrassed, hear me out. This isn't about shame or judgment. It's about knowledge and empowerment. Knowledge, because understanding the link between prostate health and ejaculation could be life-saving. And empowerment, because there's something simple you can do. Something most men do anyway, that might significantly reduce your risk of prostate cancer. So let's have an honest conversation about a topic that's often swept under the rug, both literally and figuratively. Let's talk about nuts. I'm a urologist and pelvic surgeon, and if you're new here, I make content on urologic health, bladder health, sexual health, and so much more every Monday and Friday. If you like what you see, make sure you subscribe and share this channel with your friends. Why are we talking about this? Well, despite the fact that prostate cancer is the most common cancer in men worldwide, we don't really know exactly what causes it. And so there's lots of risk factors that may increase your risk of getting prostate cancer. These include family history. So if your father or your brother, or maybe even your son has had prostate cancer, age. So as you age, your risk of getting prostate cancer increases, as well as having a high body mass index, meaning obesity can increase your risk. Also, if you have a low amount of vitamin D, or low vitamin D levels, that can also increase your risk. But ejaculation has been shown to decrease your risk. So, how does this work? Well, the prostate is a walnut-shaped gland that sits underneath the bladder, around the P-tube or the urethra. Its job is to make fluid that helps carry sperm during ejaculation. Ejaculation itself is a complex process involving muscles, nerves, and hormones. It's the climax of sexual activity, the release of sexual tension, and, in essence, the emptying of the male urethra of both fluids from the seminal vesicles. The prostate and these glands, called the bulbourethral glands, which all together make semen. Now, throughout history, there's been a lot of myths and misconceptions surrounding ejaculation, everything from it being harmful to the body, to it being a way to cure illnesses. But the reality is far more grounded in science. Let's address the elephant in the room. No, masturbation will not give you prostate cancer. In fact, quite the opposite has been shown in several studies. One such study, published in the Journal of the American Medical Association in 2003, found that men who ejaculated frequently through any method, including masturbation, had a reduced risk of developing prostate cancer. How much is frequent? They found that men who ejaculated 21 or more times per month had a 30% lower risk of developing prostate cancer compared to those who did so less than 7 times a month. You might be wondering, why does masturbation offer this protection? And the answer lies in the science of prostate health. As mentioned earlier, the prostate produces fluid that's part of semen. This fluid isn't just for transport. It plays a key role in nourishing and protecting the sperm. Interestingly, the prostate, like many other parts of the body, can become inflamed at times. This inflammation can lead to prostatitis, a condition we've talked about before. Chronic prostatitis is actually the most common reason men visit their doctor and see a urologist. However, not everyone with symptoms of prostatitis has an infection of the prostate. In about 11% of cases, the cause of prostatitis remains unknown. And that's where ejaculation may play a role. Ejaculation is essentially the body's way of flushing the prostate. allowing it to empty and potentially preventing the stagnation of fluids that could lead to discomfort or even contribute to chronic prostatitis. Furthermore, another study published in Clinical Cancer Research in 2008 found that men who ejaculated frequently had a lower risk of advanced prostate cancer. Advanced meaning higher stage prostate cancer. What's more interesting is that men who had recently undergone prostate surgery and were not yet able to ejaculate, they had a higher risk of advanced prostate cancer. This reinforces the idea that regular ejaculation might help in prostate cancer prevention. So why is this important? Well, prostate cancer is a significant concern for many men. It's the second most common cancer in men globally, following skin cancer. Approximately 1 in 8 men will be diagnosed with prostate cancer during their lifetime. And this figure rises to 1 in 7 for African American men. Early detection and prevention are crucial, yet many men are uninformed or reluctant to discuss their sexual habits with doctors. This study highlights the importance of open conversations between patients and physicians, encouraging men to be more forthcoming about their sexual activities. After all, this information could be vital in understanding and managing prostate health. While the study doesn't explicitly say that masturbation is the best option, it clearly shows that the act of ejaculation, regardless of how it's achieved, offers prostate benefits. Think about it. Many men masturbate because they want to feel good, to relieve tension, or maybe even for stress relief. And now we know that this self-care practice also benefits prostate health. This isn't about promoting any particular sexual activity. It's about acknowledging a widespread practice and helping men understand its positive implications. However, as always, if you're experiencing any unusual symptoms, including pain, discomfort, or changes in urination, please consult a healthcare professional. Your sexual habits are personal, but your health is a shared concern. By working together, patients and doctors can better manage prostate health and reduce the risk of cancer. Here's the thing. We often associate risks with things we can't control, like genetics or age. But this study reminds us that we have more influence over our health than we might think. You see, while risk factors like family history and age are beyond our control, things like diet and physical activity aren't. The same goes for ejaculation. Yes, it's influenced by personal choices, but it's also something we can encourage and normalize. This study is a testament to that. It shows that something as personal and often stigmatized as masturbation can be part of a proactive approach to health, a strategy against potentially life-threatening conditions. And that's not just groundbreaking, it's empowering. It means taking charge of your own health, understanding your body, and making choices that feel right for you. And remember, it's not about extreme measures or drastic lifestyle changes. It's about integrating healthy habits into your life. Habits like regular exercise, balanced nutrition, and yes, maintaining a healthy ejaculatory rhythm. If you're someone who struggles with feelings of guilt or shame regarding masturbation, please know that you're not alone. Societal norms, religious beliefs, and personal inhibitions can all contribute to these feelings. But it's crucial to remember that there's no right or wrong frequency when it comes to ejaculation. And whatever your choice, it should be free from guilt. Additionally, if you're facing challenges in the bedroom, whether it's with desire or performance, seeking professional help is a sign of strength, not weakness. Remember, many individuals face similar struggles, and seeking help is the first step towards a happier and more fulfilling sex life. In the end, the decision to change one's masturbation habits should be driven by personal choice and not societal pressure. While the study findings are compelling, they shouldn't be interpreted as a prescription for everyone. Instead, they offer an insight into a potential way to manage prostate health. So gentlemen, let's break the silence. Let's talk openly about our sexual health, including masturbation, and let's empower each other to make informed decisions. Your prostate will thank you for it. As always, I hope you enjoyed this video. If you did, make sure you subscribe and share this channel with your friends. And if you have any questions, leave them in the comments below. I'll see you next time.